Ladies and gentlemen, welcome to Rainbow Push Coalition's National Virtual Town Hall Meeting, Call to Action and Response. In the next 90 minutes, we'll discuss the worldwide pandemic, coronavirus COVID-19. As we all know, COVID-19 has disproportionately impacted African Americans and other communities of color. Rates of infection and death amongst the African American population far exceeds the representation of African Americans in the overall population. In some instances, by multiples of more than 5. Pre-existing health disparities and structural impediments are amplified by inadequate strategies to address the dangers of COVID-19 in the African American community and, more to the point, communities of color. Rainbow Push Coalition, in partnership with the NMA, the National Medical Association, and the National Bar Association, are seeking to address these concerns and propose viable, actionable steps that can be immediately implemented to reduce the possibility of irreparable harm due to COVID-19 on our at-risk communities. Thank you to the Reverend Jesse Jackson, as always, and Rainbow Push for convening this virtual town hall meeting. Now, let me introduce the co-host and executive producer and writer of the Keep Hope Alive radio show with Reverend Jesse Jackson. And she's also the host of her own show and executive producer of the Santita Jackson Show on WCPT Progressive Radio. Let's all welcome Santita Jackson. All right. We're having a technical issue. We can't hear Santita. Santita, try one more time. Let's see. Let's make sure she's unmuted. And I'm sure I'm showing her as I'm seeing her. Is she unmuted? Okay, she's unmuted now. Try again, Santita, please. I'm sorry. No, we still can't. We still can't hear her. All right. Well, we'll see if we can get that corrected. Therefore, without delay, we're going to have our man of the hour get us started, open us up so we can try to get right to the panel. We all know his impact on all of us historically and this nation historically, as a matter of fact. And we so appreciate him for calling together this town hall. A young man by the name of Jahan Jones wrote an article about a year and a half ago in the Huffington Post that said that Reverend Jackson is the most influential figure in the history of American politics. And I think in many ways that does, in fact, bear true. Who else would convene us in this way, and who else could we call upon at this moment in this type of crisis where so many of us are so disproportionately affected? Who else could we call upon other than Rainbow Push and Reverend Jackson? So without further ado, to give opening remarks, the Reverend Jesse L. Jackson Sr. Reverend Jackson, God bless you.
Thank you, Mark Thompson. I want to thank everyone for being at the National Rainbow Push Coalition Town Hall meeting along with the National Medical Association and National Bar Association. You're all welcome. We know what the facts are tonight. The general picture. 20 years of slavery, legal Jim Crow, lowering of all that matters. It seems there's so much pain and violence. We're dying more and testing too little. There's more pain to be had. We've been ravaged by this disease, and yet we must not stand around. Well, that comes from Maxine Waters, who heads the House Financial Service Committee, for she is targeted. I want to thank Reverend Dr. Todd Yeary, who is our Washington Bureau Chief, and who has worked so diligently to put this together. I want to thank Cynthia Jackson, who does the morning show, Progressive Radio, my daughter, if you will. And all of you who have gathered tonight, I want to bring you back on, Mark, to bring on Senator Klobuchar.
All right, thank you, Reverend Jackson. Now, folks, we are happy to have join us the gentlelady from Minnesota. She has introduced a bill to ensure Americans are still able to vote come November, the Natural Disaster and Emergency Ballot Act legislation. And we will, if media present, we'll take a few calls before she leaves. But we want to welcome now, if we could please, Senator Amy Klobuchar. Senator Klobuchar, good to see you again. God bless you.
Good to see you. Can you hear me?
You have the floor for 5 minutes.
Excellent. Well, I wanted to hear Santita too, so she has a much cooler background than I have here. So hopefully we'll be hearing her next. But I want to thank, first of all, of course, Reverend Jackson and Rainbow Push every step of the way. And I know from my own state, when there's an injustice, Reverend Jackson has been there. And seeing in Washington how he stands up in big ways when we all see him publicly, but also sometimes there'll be really bad bills and he'll show up behind the scenes to stop them and to make sure that people are represented that don't have a voice. So I want to thank him for including me, and thank you, Reverend Thompson, as well. We just spent a day today in our caucus. It was over the phone, but with people who are underrepresented, and that is the workers of America right now on the front line. And it is tremendous that people are cheering them on, the healthcare workers, when they get off their shifts at 7. That's a really good thing. But we have to make sure that those cheers are also accompanied by actual resources and actual help and actual equipment. And so it's on us to, first of all, make clear that these disparities we're seeing right now. One example, the death rate in Louisiana, 70% of deaths, African Americans, only 30% of the population. Alabama, 44% of the deaths, African Americans, when only 26% of the population. These are healthcare workers. These are people without money. And what we already knew existed, which is this glaring disparity that Rainbow Push has been pushing for decades, we know is now coming to light in a glaring way. So I don't see this as an issue that's separate from the pandemic. I see the pandemic as casting a huge light on what we know needs to be fixed right now in our country. So what we're doing now and what we've worked with Rainbow Push on is, first of all, the Republicans in Congress just wanted to make more of the same when it came to the small business program, as opposed to making sure that the money was going to minority-owned businesses and the actual small businesses that need the help. We made some big changes to that. There's still more we must do. I live in the city. I've walked by the boarded up buildings. I've walked by the boarded up businesses, and behind every one of those boards is someone's hopes and dreams, something they put their lifetimes into. Secondly, we insisted on more money for hospitals and equipment and testing, which is going to be the key to opening up all the businesses. Right now, we're dealing with situations with our workers in the meatpacking plants in Minnesota and in the Midwest, where the administration is pushing to open these without even having adequate testing and help for the workers. And that just gives you an example of what we're dealing with. We were really, really disappointed that they didn't include more city and local and state help for governments. And we're going to be pushing for that, of course, in this next package of bills. The one thing I wanted to mention is the work that needs to be done on our very democracy. That was put into a glaring light when Wisconsin voted. And what we saw was people in Milwaukee, where they had reduced the number of polling places from over 100 to 5. In Green Bay, where they had reduced them from over 30 to 5. And what we saw in Milwaukee was people many of them African American, most of them African American, in garbage bags, standing in the rain with homemade masks, just waiting to exercise their right to vote. Then flip over to the White House, pretend you see a split screen, where the president is sitting in the comfort of the White House at 1600 Pennsylvania Avenue. He gets to request a ballot in the mail. There were no rules that stopped him from doing that from Palm Beach, Florida. And so what we need to do, if it's good enough for the president, it should be good enough for everyone in the country. And that's why what this bill does, and we've got most of the Democrats on this bill, we're working on a similar version in the House. I just talked to Marsha Fudge this weekend, who's been a leader in the Congressional Black Caucus on this issue. And what it does, it says, look, we need more money to go to the states to make sure that we can pay for the postage and the envelopes and the education efforts it's going to take to make sure people know they can vote by mail. Not everyone's going to do it. I'll get to that in a minute. But we have to make it available. And right now, 12 states have horrible rules that make it harder to get your ballots. Guess right at the front, Alabama. To get a mail-in ballot, you have to have either 2 witnesses or a notary. There's a story of someone trying to vote in a primary that had to try to get a notary through the window of a hospital who had coronavirus. So we need to get rid of those bad laws. We're trying to do it federally, but state by state, there's efforts going on. But most of this is going to be to make sure people know they can do it. Right now, only about 25% of Americans vote by mail. That's the average in the last federal election. In some states like New York, it's 5%. In some states like Arizona, New Mexico, some are blue states, some are red, Utah, it is up over 90%, over 80%. And so we know not everyone's going to vote by mail magically, right, by November. So that's why our bill says, let's make that an option for everyone, but let's also keep the polling places open 20 days early. And if we can't get it done federally, we'll do it state by state so that people won't congregate at the same place and we can get the organizing message out that you should vote early if you're not going to vote by mail. Then the day of the election, we've got to train a whole new generation of poll workers because we know so many of our poll workers are seniors. So there's money for that as well so that we can have less vulnerable populations work at the polls. It is exciting what we're seeing right now because the public is with us so much, especially after Milwaukee and after Wisconsin, when people all over that state voted by mail. They were only a 6% state before that. Then they were over 1 million people voting by mail. People were horrified. They actually voted for a Democratic appointed judge in an important judge race in that state. Complete backlash at the Republican legislature, who didn't just play politics, they played politics with people's lives. So that gives us so much momentum to push for the billions of dollars that we want in this next package to go to states to help with all of this that I just mentioned. Republican governors are getting the message. A number of them have actually in New Hampshire and in Maryland and in Ohio have actually called for more mail-in ballots and for funding. And that's because of the wrath of the voters. We know that. So that's what we have to capture, and we have to keep moving forward to get the funding. This bill is going to start in the House, the next package. So not just for what I just talked about with the ballots, but also with nonprofits, so important. Our African-American churches, the work that needs to be done for support, work that needs to be done for support for city and local government. We're in a much better place when we've got the bill starting in the House of Representatives, which is run, of course, by Democrats, which is where Nancy Pelosi is Speaker and where Jim Clyburn is in leadership. It puts us in a much stronger position. So I just want to thank you. I am absolutely horrified what this administration has done and how this president basically, when he ran for office, said, I alone can fix this at his nominating convention. Then when we have this pandemic and we have people dying over the country, when we have people in nursing homes that are being lined up in trucks, their bodies, he then says, well, I'm back up to the governors. Those were his words, back up to the governors, not having that national strategy that we need. So I really thank Rainbow Push for pushing this, for doing this town hall tonight so we can get the word out. Thank you.
Senator Klobuchar, we thank you for your time. I know you've got to run, but we thank you for sharing and thank you for your diligence and your vigilance on that legislation. We'll be following up. Okay. Thank you.
Okay. Thank
All
you.
right. God bless you. See you soon
Thank you
now.
so much.
All right.
Thank you, Reverend.
Take care now.
Okay.
All right, folks. So now the next person we're going to hear from, moving right along. Yes. Did someone say something?
She's on the right side of history. We support this legislation. This time, no WikiLeaks, no TrickyLeaks, open, free, and fair elections. Klobuchar, thank you so much. God bless you.
Amen. Thank you. Next, we will hear from the president of the National Medical Association, Dr. McDougall, Dr. Leon McDougall. Dr. McDougall, how are you, sir? Can you hear me?
Doing well. Yes, I can hear you.
The floor is yours for 5 minutes, Doctor. Good to hear from you.
Well, I may not need all 5 minutes. I do appreciate Reverend Jackson, Rainbow Push Coalition, and bringing us together and giving voice to this issue. So, Mark Thompson, I'm a family physician serving a predominantly African-American community in Columbus, Ohio. And now, when someone is having chest pain that may or may not be caused by a blockage of a heart artery, I order a stress test.
Mm-hmm.
Now, the coronavirus has served as a community stress test for African American, Latinx, and Indian populations. Now, you may ask, what are the results? The results that we are aware of indicate that immediate and life-preserving intervention is required to eliminate these disparities. And that's where Rainbow Push, National Medical Association, National Bar Association, clergy, leaders, Black media come into play in sharing what we've developed in the public health manifesto. So I'm just so appreciative of having an opportunity to be a part of this program and to continue to work to advocate for better health in our communities.
Dr. McDougall, we thank you, and we thank you for the partnership with Rainbow Push. I believe Dr. Alan Milam here as well. I see you, Dr. Milam. I think we wanted to hear a word from you, Adam Milam. We wanted to hear from you, a word from you as well. Please, sir. Thank you.
Thank you, Mr. Thompson, and thank you, Dr. McDougall, and well as Reverend Jackson. So I'm an anesthesiologist and public health researcher. I'm based in Los Angeles, California. So I'm assisting with the management of COVID-19 patients, including the airway management. As Dr. McDougall spoke about, there are many cracks in our healthcare system that have resulted in longstanding health disparities. As a community, I think we need to look at the items that are put forth in the manifesto, especially widespread testing for the virus, and to really ensure that vulnerable populations such as ours have access to quality care, especially patients with pre-existing medical problems who now have poor access to care. Happy to answer any questions, and I'm happy that Reverend Jackson has put this together.
All right. Thank you, Dr. Milam. We appreciate you as well, and God bless you in your work being out there on the front lines. All who are on the front line, we appreciate them. We also would do well to get a perspective when it comes to Homeland Security and the judiciary, and who better to discuss that with us than our stalwart sister in the great state of Texas, as I always say, the successor to Barbara Jordan and Mickey Leland, Congresswoman Sheila Jackson Lee from the 18th District. God bless you, Congresswoman.
It's a pleasure to be with you. I am wearing what is now become the common attire for many around the nation and certainly around the world. This mask is what we have been told to wear to communicate with you. I will put it aside just for a moment, but it is to evidence the starkness of where we are as a nation and where we are as African American people. Let me first of all thank thank Reverend Dr. Jesse Jackson, the president of Rainbow Push, the guiding force of justice and a phenomenal leader that is now the conscience of all of us and this nation. As a senior member on Homeland Security and senior member on Judiciary, I can clearly say that major missteps were made or no steps were made by this administration in order to begin to lay the pathway for America really to achieve its greatness with the bounty of talent like the doctors that are on this panel that could have been offered in the early stages of the coronavirus. The leading voices of this present executive leadership in Washington announced between January and February that COVID-19 was not coming to the United States. Now we face 1 million cases, more dead than the Vietnam War, and out of the world's population of cases, this nation is 1/3 of those cases. So a manifesto and the work of the Congressional Black Caucus and matching that with our legislative prowess on these issues is imperative. So what is the crux of what we need to do? One, it is not to panic, it is to be prepared. And we panicked through the missteps, again, of not providing enough test kits, not enacting the Defense Production Act early on, so that, as we say, test, that we could have had the kits that could have been utilized in vulnerable communities. In many instances, imploding the Affordable Care Act and not moving forward on Medicare for all that many advocate for, leaving vulnerable populations uninsured. Just came in from a meeting with medical professionals, nurses, doctors, paramedics, pastors, community leaders, and there are communities in the nation and in our own respective communities that are not being tested. We've managed to set up at least 5 or 6 sites that have no charge and no pre-registration. Unlike the CDC guidance that I'm looking at right now, that is still telling people, don't ask to be tested unless you have fever or chills, cough, fatigue, body aches. That is not true. The $25 billion just recently passed were to test everyone. The $100 billion was to provide 75 for hospitals, $25 billion for testing. So one of the action items that we are collaborating around is to have vulnerable communities now be tested. Just as LA has announced that they plan to test everyone in LA without asking any questions. That is what we need to do in our communities. We have 2 million people incarcerated, and the prisons and jails are suffering with limited testing. We've been able to collaborate in our local jail to test the Harris County Jail. But we've seen examples of raging epidemics of the pandemic in jails in various states, from Illinois to Ohio to New York. We certainly have a high degree of positive in our jails. And so in advocating for the future, we have to lay out steps to not forget the forgotten. We cannot forget the families of the incarcerated. For if they're living in an atmosphere where they have positive exposure to those positive, or they are positive, if they are released, they need to have a clean place where they can quarantine. Essential workers who may be test positive, they are deliverers and cooks and hospital workers and others who may not have the means to stay in a hotel. We must insist that you provide for extra facilities for people to quarantine to be healthy. We have to make sure that the law that was passed under the CARES Act, under the Judiciary Committee, to provide for compassionate release is actually enacted. Unfortunately, the Attorney General intervened and changed the rules midstream against the actual law that the Congress voted on and the president signed, which is that because of the threats of COVID-19, a number of inmates that are pre-existing conditions, elderly, and other reasons could be released for home confinement. In the midst of that decision-making, rules were changed. we have to be vigilant. From the perspective of Homeland Security, we must monitor all of the employees that work under that organization. Many of them don't have the rights that they should. Hazardous pay should be in place for those aviation workers, TSA workers. We should ensure that everyone in an airport wears a mask. Everyone boarding a plane wears a mask to provide for safety for our traveling public and our community. Food insecurity is on the horizon. We have to make sure that food insecurity does not interfere with one's recovery and health. And so funding needs to be increased in the disaster supplemental and the SNAP program. Disaster supplemental program is a program that can give food stamps because of an emergency to everyone. So preparedness means that we needed to look at every aspect that would be impacted. Senator Klobuchar mentioned, and I know my chairman, Chairman Waters, will mention the $370 million that she fought so hard for, and the addition of the smaller banks, minority banks that can be utilized, and also the access to nonprofits, sole proprietors, the entrepreneurs, and self-employed, as well as our faith institutions. But let me be very clear. We have to help to fight for them to make sure that they get through the door to apply for these dollars. It is not over. So I believe that our planning has to be a makeup for the lack of action not taken by the executive. And so the manifesto and the work of the Congressional Black Caucus that talks about rental assistance, eliminating any cutoff of utilities or eviction, making sure we take care of the incarcerated person's families, and make sure we test in every jail, in every neighborhood, every hot spot. Everyone that wants a test, I'm saying it over and over again, should get a test. And I think we should leave here tonight with that at least as a top priority. And this laissez-faire attitude about you can open up, you can't open up, your state can open up, is going to create a crisis. The scientists and doctors I know have predicted there will be a surge of the coronavirus in the fall. Homeland Security should be prepared with PPEs, should be prepared with test kits, should be prepared with quarantine facilities, should be prepared in dealing with the families that cannot provide health care for themselves. We should provide expanded Medicaid in all of our states. We should just mandate that they have expanded Medicaid. And finally, on the judicial side, it is crucial that we maintain that, again, people incarcerated are human beings. And whatever processes to relieve those overcrowded jails, we should utilize them with compassionate release for the nonviolent persons to make sure that they are able to be safe. Finally, the census is something that is crucial. We've delayed the deadlines on the census. In order to provide the dollars that communities need, we need to ensure that the census is completed. And I certainly join in on the idea of protecting our rights to vote. This is going to be a very challenging time, and we must convince our national system with legislation, protecting the right to vote, restoring Section 5 of the Voting Rights Act to protect against any oppressive procedures that will be put in place to stymie the right to vote. These are the kinds of laws. My final bill, I did indicate finality, but many of the frontline medical people are not documented, or they're not status. Many Haitian doctors in particular, all working in New York and around the nation. So we're introducing legislation that will allow the medical providers that have been on the front lines that are not citizens to have access to citizenship, to increase the medical bank, if you will, to go into communities, because many of them working alongside our doctors in inner city areas. So this is being prepared and not panicking, but we've got to stand up for ourselves and take the fight to the federal government to realize that our communities cannot be left out. We must save our communities.
Congresswoman Sheila Jackson Lee, we want to thank you so much, as always. I appreciate your hard work and your diligence as well. Okay, thank you. And God bless you. Ladies and gentlemen, be patient with us. We're going to be getting to questions very shortly. We have some questions from you amongst the attendees. We next want to hear to give us a perspective on the economic and political ramifications across the country from the president of the Joint Center for Political and Economic Studies, Spencer Overton. Mr. Overton, please.
Can you hear me now?
Can hear you just fine. Yes, sir. Please.
Okay, that's great. Hey, thank you so much. Thanks, Reverend Jackson, for your leadership as well and throughout the years. You know, you continue to be an inspiration that motivates all of us to do more. Reverend Thompson, again, thank you. The Joint Center is America's Black think tank. We're located in Washington, D.C. Right now, we're collaborating with the CBC, Rainbow Push, other Black organizations, both inside and outside of DC, with a particular focus on the fourth stimulus bill. Excuse me. We do video conferences. We do a weekly newsletter on COVID. All of it's available at jointcenter.org. I really encourage you to go there. Now, I want to turn to this current situation. The unemployment claims data came out today. 3.8 million more workers filed for unemployment benefits last week. Let me just tell you what that means. By comparison, that number is 5 times higher than any week before COVID, right? And in just the last 5 weeks, more than 30 million Americans have filed for unemployment insurance. That's 1 of every 5 workers in the United States. Next week, unemployment rates by race will come out, and it seems as though Black communities will be disproportionately hit. We do know that polls show that 49% of Black workers have had their hours cut or their income reduced due to the virus. We also know that we're overrepresented in those frontline positions, as been said before, nursing assistants and restaurant workers here. And you know, we're being hit there. We know that we're being hit by the actual disease here. Now, what do we need? We need your engagement. You all can make a difference just by being engaged. You're the key to what's going on here, right? Some people who are saying, you know, the federal government has no role. Let the states and localities go bankrupt, right? And states and local governments are starting to lay off workers. And you know, the folks who disproportionately work for government, you know, like Black folks, right? And so we've got to push back on that narrative that states and localities shouldn't be supported during this time. Taxes and their revenues are down. They need some support from the federal government. There are also things like SNAP benefits. That needs to go up. It went up during the Great Recession. None of the last stimulus bills have done anything in terms of SNAP here. Now, you know, we lack capacity, but we've got organization and people in terms of mobilizing on these issues. Senator Klobuchar talked about voting. Reverend Jackson talked about voting. Incredibly important. The details are also important. So while we definitely want to do vote by mail, we want vote by mail that has so free postage, and has some other protections so that we're able to participate by mail. But then also for those folks who aren't going to vote by mail, have these kind of clean, sanitary, safe polling places is also critical here, right? Protecting Black workers, protecting Black businesses, all of this is going to be in the next stimulus. Broadband, right now, there's some kids who are learning in our country. There's some kids who are not because of this digital divide. You know that the stimulus money so far is like $2.7 trillion has been spent so far. That is about 30 times more than it would cost to give everybody broadband in the country. So we could have already done this, right? So these basic structural things we need to do in the next stimulus, and folks being engaged, that's what's key. So thanks so much for your leadership, your work. Please call on the Joint Center. Please go to jointcenter.org. We're your think tank.
Thank you, Spencer Overton. God bless the Joint Center. The Joint Center has been involved in our struggle for our people for a mighty long time, and we're always appreciative of that.
Thank you.
Bless you, brother. Next, I believe, do we have, and I'm getting some mixed signals, y'all forgive me. Do we have Congresswoman Waters? I see a phone, a handset with no name. Congresswoman Waters, is that you?
Yes, this is me.
Hello, God bless you. Welcome.
Well, thank you so very, very much. I got in a little bit late, but I was trying to follow the program to make sure that I didn't interfere on somebody else's time. But if you would like me to share some of my thoughts with you at this time, I'm prepared to do so.
Oh, no, absolutely. That's why I called on you. I know you've been working hard in the Financial Services Committee, and there's also, we know there's a need for accountability when it comes to all of these things. So please, the floor is yours.
Thank you so very much. I'm going to try and go through several things here. First of all, good evening to everyone. And of course, I'm so delighted to join all of you on this call this evening. But I cannot go forward without commending my friend and one of the most profound leaders this country has ever known, Reverend Jesse Jackson, for his leadership throughout this entire process. He's convened weekly calls with ministers. He's had elected officials that he's convened calls with, and also business persons. He has been absolutely stellar in the way that he's been able to organize all of the different interest groups across the country. And basically all of this was done to ensure that African American community was not left behind in all of the federal rescue programs, small business support, and other emergency legislation in Congress designed to address the COVID-19 pandemic. So as chairwoman of the House Financial Services Committee, I've been working around the clock and in lockstep with Speaker Pelosi in negotiations with the Senate and White House on the federal legislative response to COVID-19. I have some priorities. Some of them are outside of my committee, but my priorities have been to ban all evictions and foreclosures, regardless of whether the rental or mortgage is federally supported, suspend negative consumer credit reporting, provide $15.5 billion in homeless assistance, ensure that the hardest hit individuals receive direct and monthly payments. I advocated for $2,000 per adult and $1,000 per child. It got negotiated. It ended up $1,200 per adult and $500 per child. But I've advocated for a larger amount and will continue to do that in CARES 2, and support for small business, minority and women-owned businesses, community development financial institutions known as CDFIs, minority banks, and SBA's certified development companies, CDCs. And I've been working with Secretary Mnuchin and Federal Reserve Chairman Jerome Powell to ensure that their lending facilities, which now number more than 10, and other extraordinary liquidity measures are achieving the goals of helping imperiled small businesses and smaller banks, and not simply the largest bank and industry shareholders. Prior to the passage of the first CARES Act on March 27th, my committee released our own proposal that went even further than the agreed upon legislation, so that we could push the negotiators to really consider the plight of consumers, homeowners, and the African American community, which has been hardest hit by the pandemic. So I'm pleased that, building upon my proposal, again, the bill created that direct payment for most individuals and families across the country that I just alluded to, the $1,200 for each adult and $500 for each child, to help our families during this unprecedented crisis. I'm going to continue to advocate for the $2,000 for the adults and $1,000 for each child, again, in the CARES number 2 Act. In addition, thankfully, after I and other Democrats spoke out about the lack of homeless assistance in the first package for the coronavirus relief, the CARES Act included $4 billion for the homeless assistance. Remember, I was advocating for a higher amount, $14 billion. I got $4 billion in that first package, and I'm going for the rest of that in the second package. Unfortunately, within days of the passage of CARES 1 in March and upon the launch of the Paycheck Protection Program, that is the PPP that everybody's been talking about, which the legislation that was created to provide forgivable loans for small businesses that pay employees and keep them on the payroll. I began receiving complaints from all of these small businesses within my district and across the country who have been completely shut out of the process. Many of our smaller minority-owned businesses were denied service from some of the big banks who told them they could not work with clients who were not already their customers because of the Know Your Customer regulations. Other banks complained that federally imposed asset caps prevented them from making more PPP loans. And as the first round of PPP funds were depleted, we also learned about how the first round of funds were distributed. So, according to the New York Times reporting, banks such as JP Morgan Chase, Wells Fargo, and U.S. Bank gave concierge treatment to their larger clients, including unique access to customer service, online portals, technical assistance, and other news outlets reported that Monty Bennett, a hoteler and Trump supporter who owns a chain of hotels, was one of the largest beneficiaries of PPP, a combined total of $59 billion from the small business lending package went to 3 lodging companies chaired by Monty Bennett. His companies were able to game the system in that each hotel subsidiary could apply for the PPP loan as long as each hotel had under 500 employees. The New York Times reporting was not surprising to many of us who understand how the industry operates. Our financial system is inherently designed to serve the interests of their top clients. Too many of the larger financial institutions do not take the time to work with our smaller minority businesses, many of which are sole proprietorships because these clients do not bring in the fees that the larger clients can generate. So this is why I stress the importance of set-asides and targeting prior to the passage of the emergency supplemental to provide additional funds to the PPP. The legislation we passed last week, the Paycheck Protection Program and Healthcare Enhancement Act, strengthens PPP by prioritizing America's smallest businesses, including minority, women, veterans, and rural businesses, by increasing the Paycheck Protection Program by $310 billion from $349 billion to $659 billion, creating a set-aside of $60 billion specifically for community financial institutions, including community banks, credit unions, CDFIs, MDIs, microlenders, and CDCs. Specifically, $30 billion was set aside and made available for banks and credit unions, including minority depository institutions, that's our MDIs, with more than $10 billion in assets, but less than $50 billion in assets that are PPP lenders, and another $30 billion for banks and credit unions with less than $10 billion in assets, as well as all community development financial institutions. Again, those are the CDFIs, MDIs, certified development companies, the CDCs, and micro lenders that are PPP lenders. This set aside does not prohibit these community lenders from also accessing additional PPP funds available to all lenders. So I was pleased that this bill specifically set aside the $60 billion of PPP funds for our nation's community development financial institutions, all of those that I've identified, and of course, certified development companies and micro lenders to lend to the neighborhood small businesses and minority-owned businesses across the country that need funding the most. I've also urged the Treasury Department and SBA to remove existing impediments that keep non-bank CDFIs, like CDFI loan funds, from participating as lenders in the PPP, including by reducing the 50 million loan volume requirement. Now, let me just say we've got a lot of work to do. I've learned an awful lot about not only some of what the big banks did, but what's in our existing laws that are really discriminatory. They talk about support for small businesses on both sides of the aisle, but it's a bunch of hypocrisy. They don't consider small businesses. And when we talk small businesses and they talk small businesses, we're talking two different languages. For example, with the CDFIs, the Treasury Department said that they had to have done $50 million worth of business to be eligible. Well, we cut that down and we backed them down to 10 million, and we're still working to reduce that requirement altogether. But those are the kind of things that mitigate against being able to support small businesses. And there are a lot of other things that we've discovered. And so we have work to do in addition to what we're doing now to try and make this pandemic work, the response to the pandemic work for everybody. Now we've got to change a lot that's in existing systems that work against our ability to fully participate. I remain dismayed by the reports that large corporations received loans intended for small businesses. These reports came after we also learned that hedge funds and private equity funds were hoping to use the PPP. That was clearly not the intent. For this reason, I've also called upon Treasury and the SBA to ensure that the $370 billion in new funding is prioritized to actual small businesses. The Treasury Department took some steps to address these concerns when it created a window. And we did this because we're doing everything that we can possibly do. They created a window that we supported from 4 p.m. yesterday to midnight, during which only the smallest lenders with less than $1 billion in assets could submit applications on behalf of their small businesses customers to the SBA. I've been talking with CDFIs and MDIs today. They were able to get in on that, and they were able to process some of the applications that they had, but they couldn't get in everything, and they are still wondering what can be done similar to that effort. But what we're finding now is because of the shame that has been placed on many of the big banks, et cetera, and because we have learned how they created some rules of their own, they are trying to now show that they're going to direct some of these funds to these small, very small customers and businesses that have been standing in line, many of them who had numbers that have been assigned but not been taken care of. So we're still working on that. And so the legislation we passed last week improves the PPP, but there's still so much work to be done to assist all people in the United States, and especially our vulnerable communities through this crisis. And in the next bill, it is critical for Congress to provide additional assistance to struggling homeowners, renters, landlords, and people experiencing homelessness. I and the Financial Service Committee are proposing a creation of $100 billion for rental assistance and $75 billion for homeowner assistance. We're putting together funds so that struggling families are able to cover their rent or mortgage payments as well as utility payments. I'll be working with my colleagues to ensure that these and other critical elements of the committee's proposals to protect and help our communities are included in the next coronavirus response package. We must get the data to understand the extent of COVID-19 racial disparities. We must ensure oversight of these federal programs to ensure they're reaching the businesses most in need. We must provide additional direct payments to taxpayers. We must ensure the U.S. Postal Service is saved so that it can continue to deliver mail and help the country through the next election with the increases in vote by mail. We must ensure resources are targeted. We must ensure mass testing and the production and deployment of PPE so that much of this will take a coordinated federal, state, and local strategy. One thing is for certain, the president has been little more than a nuisance and a spectator, characteristics that make him, during the times of crisis, a liability, one likely to cost us Americans lives. Members of Congress, health officials, the governors, mayors, and local officials must now band together and rise above Donald Trump's failed leadership to ensure we can pull the country through this pandemic. I rushed through this as fast as I could I know that you have people with questions, and I'm prepared to stay online and answer any questions that may be directed toward me. Thank you again, Reverend Jackson. Thank you again, Vice President Yerlin. Thank you, all of the staff and supporters of Rainbow Push who have been so active in helping to focus us and bring some of these things together. I appreciate working with you. Love you, and look forward to the work that we have to do for the future.
Thank you so much, Congresswoman Waters, and we appreciate you. And of course, we all love you as well. Thank you for that presentation. A lot of really great information there, folks. We're going to get to the Q&A. We have one more member of Congress that we're going to hear from now. He has demanded as well there be greater accountability, even demanding that the president have a national shelter in place. There has not really been a national policy coming out of the White House, but the congressman from California, the gentleman from California is with us. We want to hear now from Congressman Ro Khanna. Congressman, God bless you and welcome. Go right ahead, please.
Reverend Thompson, I should just say amen to everything that Representative Maxine Waters said. She has been extraordinary, and she laid out in such detail the agenda. I do want to commend Reverend Jackson for being a visionary, an icon, a hero of mine when I was growing up, and someone who is still so engaged, who calls me, calls Representative Waters, calls members not just in the Congressional Black Caucus, but throughout Congress with his ideas, with his concern for those who are underrepresented, and Cynthia Jackson, who has done such an amazing job on her show in highlighting these key issues. I don't want to repeat a lot of what Maxine Waters said. I just want to highlight a few key points. One, I understand that Rainbow Push has called for $1 trillion in PPP funding, and 50% of that needs to go to the banks, the minority development institutes, and to the community banks that actually will get the money to people of color. It's outrageous that so much of that money has gone to the connected, has gone to people who have relationships with the banks. It hasn't even gone to small business owners, and many of the minority community has been excluded. And when I have spoken with people at Treasury, I have made the point that we need data about who those loans have gone to, who has been excluded. I mean, this is not the 1980s when Black farmers were excluded from USDA loans. We're in 2020. The fact that this is happening again, that minorities are being excluded from these loans, is outrageous, and we need data and we need transparency. The second point I want to hit is on the Essential Workers Bill of Rights that I've been pushing for with Senator Elizabeth Warren. As you know, 50% of people in the hospital sector and work industry are Black. That's far higher than white workers or Asian American workers. And they're also overrepresented in a lot of the service industries that are the essential workers that are basically caring for our sick, making sure we're getting groceries, doing all of the work that keeps the economy running. Unfortunately, the essential workers also are at the most risk for COVID-19. That is because they are being exposed. And it is outrageous. It is simply outrageous that they don't have basic protection, that they aren't getting the masks and the equipment that they need. There are cases, I was talking to a woman in New Jersey yesterday. She was telling me, an African-American woman who was telling me that she's standing shoulder to shoulder in an Amazon warehouse, putting packages together. Forget social distancing. I mean, she's literally touching other people as she's doing her job. And that is a collective guilt, because all of us who are ordering things on Amazon, or all of us who are benefiting from this, we have a moral responsibility to make sure that the workers are treated fairly, that they can be whistleblowers if they're not, that they're getting hazard pay, that they're getting health care, that they're getting childcare, and that they're getting the basic protections. And so I've been pushing for the Essential Workers Bill of Rights. And the final point is on the shelter in place. I mean, I had called for a national shelter in place months ago when this crisis was just starting. My district, we sheltered in place on March 13th. And it was because of that decision that we have managed to have less mortality, less deaths. And if you look at the disparate impact, the people who have been hit I mean, in Washington, D.C., 95% of those who were dying were African American. So we needed to have a policy based on data. We should have had a national shelter in place back then. We would have come out of it much sooner and with much fewer fatalities. And I still believe that the biggest problem in our country has been the lack of national guidelines and the lack of testing from this administration. So I just want to thank the Reverend Jackson, Rainbow Push, for continuing to be advocates for real people who have real concerns. And I will continue to do what I can to complement our great leader, Maxine Waters' work, a phenomenal chair of the Financial Services Committee, and to continue to push the agenda.
So thank you, Congressman Ro Khanna. We appreciate you and appreciate all of your hard work as well. Folks, we're going to have a few questions now that have been submitted in the Q&A from some of our attendees. So I'm going to start with one. This question is from Brenda in Kentucky, it appears. Is anyone or any agency assessing the nature around the superfluous COVID-19 deaths among African Americans to see if there are some consistencies surrounding those deaths? Would anybody like to answer that question? Dr. McDougall, Dr. Milan, either of the physicians? Yes.
So there's a much higher percentage of people who are dying that actually have diabetes. And we know that the African American population has a higher prevalence of diabetes. And we're finding too that people who are infected with COVID-19 and have diabetes are much more likely to have more severe disease, and especially for those who have uncontrolled diabetes with high blood sugars. We're thinking that decreases the immune response and sets people up for more problems as they undergo treatment and less response to those treatments.
Okay, thank you. This question is from Makita. Will there be a specific provision for companies that identify as MBEs, SBA 8A, or other disadvantaged designations? Will there be a specific provision? Is Congresswoman Waters still with us?
To be referred to, okay.
There
She
you
appears
go.
to be referred to some of the existing SBA programs, and it's not quite identified like that. For example, when you talk about 8A set aside, that's an existing program, but it is not organized in such a way that the person who is the recipient of 8A set aside somehow is involved with PPP. PPP is designed so that the banks who have the big numbers of organizations are able to distribute funds. The minority banks, the MDIs, the community development financial institutions, the credit unions, and the community banks, these are the ones, and some of our micro lenders that we haven't talked a lot about, are all organized in a way that they can do the lending. So when you look for how you can place an application, it's one of those institutions, and many of them have websites. And then, of course, I've been working with Reverend Jackson about the connection that's been made about a portal that they may talk to you about a little bit later on if they haven't already talked about it. And it's called Our Fair Share, where anybody can go and get some help and get their applications transmitted to the banks by technology that's owned by Black people, et cetera. So if you're looking for where to go and who is responsible for the applications for PPP, it's those kinds of organizations rather than some of the existed SBA kinds of opportunities that already exist.
Okay. Thank you, Congresswoman Waters. We're going to get one more question in, and then we're going to go back to our panel.
Mark?
Yes.
Reverend Todd Year, who is our senior VP and who is our Washington Bureau Chief, is our point person on this whole project. He has done the most. He has a great insight into getting people's money as anybody I know. Reverend Todd Year, please respond before he goes to the next panel.
Is Todd there?
All right, there we are. I'm unmuted now. Thank you, Reverend. Good evening, everyone. As Madam Chair has mentioned, the work around getting access to capital during the COVID-19 response has been fraught with a number of challenges. When the portals began to open in phase one, there was still a lack of clarity about who was actually included or excluded, whether churches were included or excluded, whether independent contractors could get access to the funds. We actually lost quite a bit of time in phase one, even to get started, much less dealing with the added frustration of some of the challenges with the expanded rules applied by some banks, not just all big banks, regional banks were gating as well. And so we did what we felt was necessary to try to get ahead of this when round two was coming up. To that end, we focused on how to get technical assistance on the front end to small businesses, faith-based organizations, nonprofits, even independent contractors, to be able to connect with the process sooner. We recognize that $349 billion was actually spent in under 2 weeks, and that there was a building queue even while we were waiting on the new appropriation to come through the Congress. So we stood up in about 48 hours a technical assistance framework grounded in the website rpccovid19.com, rpccovid19.com, to begin to educate small business owners, our constituents, to be able to know how to work through the application, understand the rules, how to protect themselves from possibly being left with the debt burden at the end of the program. And so what we wanted to make sure of is that we did what was necessary to connect to that process and also connect to ourfairshare.com, which allows us to actually have a national reach. Anybody can actually go to our website, walk through that technical assistance, and whether you're in Chicago, where we're headquartered, or anywhere else in the country, we can then help you get the application and the documentation necessary to access the program before prayerfully the funds run out. So that's the quick flyover of where we are. rpccovid19.com is our effort, our ongoing effort to support us during the midst of this economic uncertainty.
All right. Thank you, Reverend Yeary. We now want to hear from the mayor of Houston. Is he? Well, yes. So, Mr. Mayor Turner. Yes, sir. Can we unmute Mayor Turner? There we go. God bless you, sir. Go right ahead.
Thank you. And let me also acknowledge Reverend
I think you turned your video off, sir. You was on. Try to turn it back on if you can, so we can see you.
You don't have me on?
No, it was on and then it went off. If you can hit that little button in the bottom right-hand corner. So there you go. We see you now. Go right ahead, sir. Let's spotlight Reverend Mayor Turner.
Thank you, Reverend Thompson. And also let me acknowledge Reverend Jackson and Operation Push. Let me thank you all for the work that you have done over the years. And so very much appreciate being a part of this. And let me also quickly thank our congressional leaders for the support that they have already provided to many of the people, or to the people in our respective cities. Very much appreciated. The CARES Act has been a tremendous plus. So I can't say enough. I know my Congresswoman is on a part of this town hall meeting, Congresswoman Sheila Jackson Lee. So I want to acknowledge her, and certainly Congressman Al Green. for the work that they have done on behalf of the city of Houston. So let me just start off by thanking you. This pandemic has been unprecedented just today, and it's still here. The virus is still here. It's still prevalent in our respective communities. Today, I announced another 98 cases and people tested positively. Death-wise, we announced another 4. And even though the city of Houston has fared fairly well, a total of 56 people who have lost their lives directly as a result of COVID-19, still it's too many. And I will tell you, 75% of the people who have lost their lives in the city of Houston have been African Americans and Hispanics, with African Americans counting for over 50% of that total, when we only represent about 20% of the population right here in the city of Houston. With respect to all of them, with the exception of 4, all of them have died with underlying medical conditions, diabetes, on dialysis, hypertension, sickle cell. So we're very, very sensitive to that population. And I've already established a task force that focus on our at-risk vulnerable populations, because we want to make sure that we don't leave anyone behind. As you all know, the state of Texas is preparing to open up a little bit more tomorrow. So as it relates to movie theaters, malls, retail, restaurants, they will be open tomorrow, 25% occupancy. And so, but this virus is still very much here. And it is all about testing. I want to thank again our congressional leaders for making sure that there was $25 billion in this last bill for testing. We needed to be more widespread, robust, ubiquitous, because quite frankly, it is through the testing that we will get our eyes on where this virus is and how pervasive it is within our respective communities. For me, it's not enough to say we're going to open up and then try to move forward. And then for people in these most at-risk, vulnerable communities, they're the ones that's going to be hard hit. And so we're emphasizing to stay home, engage in social distancing, wearing the face coverings. But for many of our people, especially that live in communities that have been underserved and under-resourced for decades, social distancing is not always something that's practical, especially when there are 7, 8, 9 plus people in their homes, like the one in which I grew up in. It's not always practical. And so we're really pushing hard to provide them with the educational materials that they need, the resources that they need. That's a critical component. With regards to and these are individuals who are on the front lines. Whereas we prepare to open up, they are already on the front line. They are the ones who are bearing the brunt of this pandemic. And so I appreciated what Congresswoman Maxine Waters was saying about the rental assistance. That's critical. We are preparing to put forth a rental assistance bill before council next week to provide some assistance to these individuals who are still hurting. And we need to do a lot more. So there's a lot more that's needed to be done. The programs on homelessness, we've already taken some steps to address that population, but that's a very vulnerable population. And we're just with many of them on yesterday, and we need to be doing more even in that regard. Dollars for our small businesses, MWBEs, they've been hard hit. And with all that has already been done, many of them are still bearing the brunt. And so the cities, like City of Houston and others, are trying to step up and to provide additional resources in addition to resources that have already been made available on the congressional level. And then the other point that I would want to make, especially since we have some of our congressional leaders on the line and many key leaders from across the country, I appreciate what was done with the CARES Act, but it does not allow us to utilize even some of those dollars in order to fill in the revenue gap that we have lost, specifically as related to COVID-19. And so, for example, when businesses have shut down, sales taxes are not coming in, many of our cities are taking a huge hit. City of Houston is taking a huge hit on its sales tax. I have a budget that I must balance by the end of June. We cannot engage in deficit financing. And so already thousands of the employees in the city of Houston will have to be put on furlough because of the budgetary shortfall. Cadet classes are having to be deferred. Payments are having to be deferred because the dollars are not there as a result of COVID-19. And so I would certainly ask the congressional leaders, with respect to the dollars that have already been provided, to provide us with some flexibility to utilize some dollars to just fill in the revenue gap. Otherwise, thousands of employees, municipal employees, people who need their jobs are going to be hurt as we move forward. And then as we go forward, there are additional dollars that all cities need in order to address the needs in their particular cities. Because for many of us, it is important that we are on the front line in providing the necessary services for the people in underserved and under-resourced communities. But again, Reverend Jackson, thank you for what you have continued to do. To our congressional leaders, thank you so very much. And for the others who have given a voice on behalf of all of us, very much appreciated. And I look forward to joining you all in the fight in the days ahead. Thank you.
Thank you, Mayor Turner. I guess it's needless to say, in your position, you do not agree with the Senate Majority Leader that you should file for bankruptcy, correct? You don't have to answer that. I think we know. I think we know the answer. Amen.
I don't know. Look, I'm a Christian brother, so let me reserve my words.
Very good. Very good. We'll keep you muted so you don't get in trouble. Amen.
All right,
thank you, sir. All right. Thank you. James Gomez, MPA, will now talk to us about the global impact, particularly on Africa, too, I believe. James, are you there? Can we unmute James? And folks, I'm sorry, I'm gonna have to be a little bit more forceful with the time because they're telling me the clock is running out. So if we can keep everybody to 3 minutes or less, we'd appreciate it. Brother Gomez, bless you. Good to see you, brother.
Good evening. How are you?
Fine, man. Go right ahead.
Thank you. And I also want to thank Reverend Jackson for convening this very important and timely meeting. And also for the members of Congress who have been very active in terms of assisting not only Africa, but the international community as a whole. I want to start by giving a brief update on the situation in Africa. According to the Africa CDC, as of this morning, there are about 37,000 cases, and about 1,500 deaths. And these numbers continue to change because of the issue with testing. And the issue of deportation is more of an issue within our hemisphere here. For example, on April 7th, the United States deported 61 Haitians back to Haiti and 75 to Guatemala. And according to reports, some of them tested positive for the virus. So this is a very concern, especially for Haiti, a population of about 11 million people with about 39 physicians who manage the virus and about 124 ICU beds and about the capacity to only handle 62 people in terms of ventilation. And which is also similar to Africa, where you have 10 countries without any ventilation and about 2,000 ventilators to serve about 100 million people across 41 countries. And this is a very problematic issue. The same thing applies when it comes to intensive care beds. There are about 5,000 intensive care beds for about 43 countries. As you can see, it's a major issue. And in terms of foreign aid trickling into the continent, it's coming in, but not at the rate that is required that can help them fight this pandemic. The European Union have committed about 20 billion euros for the continent as a whole, in addition to the individual European countries giving out different aids to different countries based on relationship. And the United States have committed about 170 million US dollars. And the Secretary of State had a conference call last week with a press conference regarding Africa. And he also pledged that there will be more aid coming. President Trump also spoke with the Prime Minister of Ethiopia and the President of South Africa, Ramaphosa, who is the chair of the Africa Union. And President Trump also pledged that he will be sending more ventilators and more aid. So we hope that these things will start flowing to the continent as soon as possible, because as you know, the virus is not waiting for anybody.
Yes, sir.
It's infecting as days goes by. One of the earliest aid to trickle into the continent came from China, from the founder of Alibaba, Mr. Jack Ma, who was able to provide about 1 million testing kits, about 6 million masks, and 60,000 protective suits, which was very needed for some of the countries that received this assistance, because it was just devastating, based on what was going on around the globe. And also, in terms of aid, the IMF decided to cancel 6 months worth of debts to 25 of the poorest countries in the globe. But most of those countries were from Africa, and Haiti was also able to qualify as one of those poorest countries. So our action plans should be to continue to advocate for more action and to have the United States take the lead. And I'm glad we have some members of Congress, Honorable Sheila Jackson-Lee and Maxine Waters. They have been very, very helpful in terms of, especially with Haiti and also Africa. And I hope that they will continue to do more to make sure that Africa and Haiti is not left behind. Thank you.
Thank you, Brother James, and so much for that urban myth that people with melanin were immune to this. Remember, we all thought that early on.
Mhm.
Some folk thought they would go to Africa to escape the virus, but we know that's not the case. Thank you for that. We now want to hear from the partner and CEO of the Hoffler firm, also chair of the Rainbow Push Coalition Board, attorney C.K. Hoffler. C.K., are you there? Do we have CK? There we go.
Okay. First of all, thank you so much to Reverend Jackson, to the congressional leadership that's on this call, to the medical representatives on this call, to all of the big thinkers who have assembled here tonight to address these incredibly important issues. It's such an honor for me to be on this call and to be amongst you and to come up with solutions to this crisis for our community. I've worked with Reverend Jackson for 32 of my 33 years as a lawyer. And I've had the pleasure of working on so many issues, but this by far has probably been one of the most devastating pandemics or crises that we have confronted in our community. I am also president-elect of the National Bar Association, and I'm going to very briefly give you all an overview of some legal efforts that I think could inform this community, our community, and could help us chart out steps going forward. This is a pandemic, and certainly it's a medical crisis. But the legal component is very, very important because there might need to be, and there have been, challenges in the court. And I'd like to focus on three major areas. The first challenge that Rainbow Push and many of us are engaged in is the incarceration of inmates in various places. We know that there's a pending lawsuit in Dallas County against the Dallas County jail system. We believe, a very good judge, and hopefully there will be some favorable rulings that will come down in that case, where we're asking for the compassionate release of a number of inmates. This is a problem throughout this country and certain urban areas in our communities. We know that Black and brown people are disproportionately impacted by COVID, but in the prison system, it is more than a disproportionate impact. It's pretty much across the board, Black and brown people that are impacted, with some exceptions. They are literally in just awaiting death. It's like being in a situation where you know death is certain because it is impossible for them to do so, practice social distancing. They do not have testing. They do not have masks. They do not have gloves. They're inmates, and some of them are just awaiting arraignment. This is a crisis of monumental proportion, and that is something that some of this litigation may address. Rainbow Push has decided to team up and partner with the ACLU and other organizations, including the National Bar Association, to put forward and to identify 10 of the most egregious situations that exist throughout this country so that we can bring litigation to the forefront to fight this. Because sometimes you just have to file suit to get justice. So that's one project. Another project is election protection. As president-elect of the NBA, and I'm going to be president in 3 months, one of the things that our lawyers do and have done successfully and done extremely well was in the past to protect people's right to vote. Reverend Jackson and so many marched so that people could vote. But it is our mandate to protect the right to vote. Well, with the situation that we have with COVID and what that will mean for the elections coming up, the task of the lawyers or the tasks that we will have are complicated because we're probably going to have mail ballots. We're going to have absentee ballots. We're probably anticipating more legal challenges because there are efforts to undermine the election process and to enhance election suppression. So that's another area of focus. Another area of focus is representing workers. We have seen in the media, and we know this to be true, that COVID in the workplace has affected the least of these, the people on the front lines, the people who are working in warehouses, on the assembly lines, whether they're at Amazon or whether they're at Tyson Foods. These are the people who are impacted, and they too have not been given protective gear, gloves, masks, or even sanitary conditions to work in, which would enhance the spread of this disease, of COVID-19. I have the absolute pleasure and honor, just as I represent one of the most extraordinary leaders in the world this world has ever seen, that's Reverend Jesse Jackson. Having represented him for 32 years, without a question, that's been the highlight of my career. I now have the pleasure of representing Christian Smalls. Who is this young man? He is a former worker of Amazon who just refused to be denied. All he wanted in the beginning was for there to be protective gear for the workers, for himself, so that they would not contract a virus that is so deadly because of the nature of their work, because of the close quarters. And Amazon didn't take his request seriously, didn't take the workers seriously, and Amazon was not compassionate and frankly didn't care. So he reported them. He took the courage and the steps to report the largest and really one of the most profitable conglomerates or businesses in the world. He reported them. And as a result, he was terminated. The New York State is right now, as we speak, investigating a whistleblower action because he told them he was going to report it, he did, and as a result, he was terminated. Oppression of the least of these. For somebody who stood up for the workers and he protested. And guess what, ladies and gentlemen? Tomorrow he is launching one of the largest protests, not just nationally, but internationally, that this country has ever seen. This young man, African-American man, Christian Smalls, who happens to be on the line, and I also must recognize his mother, who is, I'm told, may be on the line too. So against that background, Christian, Chris as we call him, I'm going to ask that you address this extraordinary group of people comprised of Rainbow Push Coalition, who I know Reverend Jackson is one of your mentors. And we know that we all stand on his shoulders, our congressional leaders, our medical doctors, all of the leaders assembled here today. We want to give you the opportunity to talk to, because you are our future and we want to hear from you. Chris, are you on the line?
Absolutely. And thank you, CK, for that amazing introduction. Without you, without Reverend Jackson, I wouldn't be sitting here right now. So I want to thank you guys for having me on this call tonight with all these prominent people. I know my mom back home, Dawn Smalls, I know she's watching. Without her, I wouldn't be here. As CK said, on March 30th, I put my 5-year career on the line to save the lives of my employees. I was a supervisor for Amazon, been with the company since 2015. I saw this pandemic hitting this country in a wave that we never seen before. During these unprecedented times, I took a stance that I thought was right. I put my career on the line. It cost me my career, but I still have no regrets about it. This virus has no remorse. These people that I stood up for, the voiceless, they're my extended family. Still to this day, I spent 40, 50, sometimes 60 hours a week with these people for a number of years. These people were my extended family. And right now, I need everybody to support me as I take on the richest man in the world. And tomorrow we're launching something that is historical, an alliance between major corporations. Some are competitors, some are subsidiaries. Something that's never been done before. But we all have one common goal right now, and that's to save humanity, save society. I stood up because I didn't want to bring this virus home to my family, my kids, who I haven't seen in 2 months. I stood up because I didn't want to bring this virus home to our communities. My employees that stood with me, they did the same thing. Staten Island, That's the building that we worked at. It's 5,000 employees there that come in the building weekly. This virus spreads to 2.5 people. Do the math. There's your epic center in New York City right there. These people come from all 5 boroughs. They come from all parts of New Jersey where I reside. I stood up because I thought this was the right thing to do. This is life or death.
Chris, I hate to cut you off, but I'm under the gun.
Sure.
We're going to have obviously another town hall to hear more of your story.
Absolutely.
But, you know, people should realize it was the everyday people who were going to work, riding the buses in Montgomery that stopped that. It was everyday people picking up trash in Memphis that stopped that foolishness. And it's going to be the everyday people, just like Chris, working at the Amazons and other places, going to stop this foolishness today. So, Chris, you on par with those people, and you're a hero to us, brother. Okay. So
thank you.
Thank you, man. And we'll follow up with you. And I'm here in New York with you. So we got to get together. All right.
Absolutely. Appreciate it.
We're going to hear from 2 more people. Rashawn Ray, who's the David M. Rubenstein Fellow at Brookings Institute. And sorry, Dr. Ray, we're short on time, but if you could give us a synopsis of some of your study and research on the disparity, please. Thank you.
Yeah, I'll be quick. Thank you, Reverend Thompson. So, Chris, we definitely support you. Thank you for your sacrifice. Thanks to Reverend Jackson, Dr. Yeary, and the Rainbow Push staff. I think when we think about what's happening now, we know, and there's a saying that all of us know, that when America catches a cold, the Black community gets a flu. Well, in 2020, when America catches COVID-19, Black people die. And that's part of what we're seeing. And part of it is really setting the tone for the work that I've done at Brookings with FixGov to really highlight the structural conditions undergird pre-existing health conditions. What do I mean by this? Well, predominantly Black neighborhoods have a lack of healthy food options, a lack of recreational facilities. We're more likely to live in densely populated areas. So social distancing becomes a privilege. We're more likely to be these new essential workers, less likely to have healthcare access, and less likely to receive equitable healthcare. Part of what that means is oftentimes we are spoken to instead of spoken with. I think it's 3 specific stats. First, we know in these states that I've analyzed in the Midwest and the South, that Blacks are 4 times more likely to die from COVID-19. We know in prisons that prisons becomes a main source of where we see COVID-19. In Washington, D.C., where I happen to be, what we see in the D.C. prison is that D.C. prison has a rate of 14 times that of the D.C. city population, 14 times. I mean, that's astronomical. It doesn't even fit on normal statistical graphs. And then, of course, we know that there are about 500,000 people in pretrial detention, meaning they haven't been convicted of a crime, but they simply haven't been able to afford bail. These are the types of people who we are talking about that need to be home instead of being in prison. And I think a lot of these stats, particularly the fact that about 90% of Black-owned businesses were denied from PPP funding, that these outcomes really highlight a 21st century redlining. And I think it's 6 things we can do about it. First, we need to stop taking a colorblind approach to COVID-19 and start taking a health equity approach. Part of what this means is we need to collect better demographic data. We need testing in Black communities. We need to make sure that Black churches are part of this. This SBA funding needs to specifically be allocated for Black-owned businesses, Latino-owned businesses, and women-owned businesses. A part of this is because the discrimination that has led to us not receiving this. We also need paid sick leave, hazard pay, and a living wage. And of course, we need universal health care.
All right. Thank you, brother. And thank you for being so concise. Next, we'll hear from the pastor of Friendship West in Dallas, the Reverend Dr. Frederick D. Haynes. Please, sir. Bless you, man.
Thank you. Thank you,
brother
Mark Thompson, for your leadership. Thank you, Reverend Jackson, for your charisma, bringing all of us together, and for the way you continue to see what we ought to be. I'll simply and quickly say it's impossible to lock up a virus. An infection anywhere is a threat to good health everywhere. So we are calling basically for the protection of those who are in prison. And most importantly, we are determined to depopulate jails. Reverend Jackson is determined that we have a criminal justice commission. So we are calling for the adherence to the 8th Amendment to the United States Constitution, and in the language, or to remix our ancestors, we are saying, let our people go. And we're calling for these things. Number one, we need to make free testing and, if necessary, free treatment available in our prisons and jails. The incarcerated and those who work in those facilities deserve to be protected. It's already been mentioned. I repeat it for emphasis, and that is our jails and prisons are not closed institutions. You have persons who go there for work. You have persons who are released. And if it becomes an incubator for disease, the sad reality is we discover you cannot lock up a virus. Number two, we'd have to commute the sentences of the incarcerated people who are a part of vulnerable populations. Thirdly, we need correctional authorities to make telephone and video calls free for the duration of the crisis, and where necessary, work with private vendors to achieve this goal. Next, we need correctional authorities to further waive commissary fees for soap, toilet paper, and other hygienic essentials for the duration of this crisis. The sad reality is a lot of these prisons and jails are downright filthy. Next, the elderly and sick people and those incarcerated for parole violation should be released or recommended for release under compassionate release provisions or another authority. Finally, the conditions for release should include incarcerated individuals who have served at least 25% of their sentences and who have less than 18 months remaining on their term. These are just a few of the demands. I could also talk about the fact you have too many people who are sitting in jail waiting for a hearing. They can't afford to be released. They need to be released. We're simply saying at Rainbow Push that being arrested and working in jail should not be a death sentence. Jail houses should not become pathways to funeral houses. And we sure don't want Jesus in the judgment to say about this nation, I was in prison and you made my cell become a cemetery.
Amen. Amen. Thank you, Freddie Haynes. We appreciate you too, my brother. We are 8 minutes over time, which isn't bad. And my stage managers and producers are sending me a couple of mixed signals. So why don't we do this? I'm going to go with the first instruction I received in the interest of time. Why don't we get Reverend Jackson? No, okay, I'm sorry. Congresswoman Sheila Jackson Lee wanted to say another word before we have Reverend Todd Year and then Reverend Jackson. Okay, go right ahead, Congresswoman Sheila Jackson Lee.
Thank you very much. And thank you to all of the dynamic and profound panelists from the continent to here in the United States. Let me indicate and reaffirm the largest number of people that have died in the United States because of COVID-19 are from the African American community and from the Latino community. African Americans are number one. Let me also confirm the fact that 2.2 million people are incarcerated across the nation's jails. And so the manifesto on the issue of jails is crucial because the numbers of individuals who are in the jails who test positive is astronomical. We need bail reform, as has been indicated, but in the federal system, we must enforce the CARES Act that says that you are able to have compassionate release and home confinement and not have it thwarted by the Attorney General of the United States. We must assist collaboratively to deal with that. As it relates to essential workers, like our dear friend that we heard from New York, Staten Island, and Amazon, we have to not only support them, but provide them with hazardous pay and all of the PPEs that they need, which is supposed to be part of the responsibility of the federal government in issuing the Defense Production Act. We must institutionalize the issues of dealing with minority businesses, period. Because yes, when we sneeze, minority businesses and African Americans, minorities get pneumonia. So I see the importance of codifying language that is now only under the emergency declaration, but we must find a way to infuse dollars into minority businesses post-COVID. We also need to know that COVID is expected to surge again in the fall. that means there has to be a long-lasting response. I joined Chairwoman Waters. I had offered $3,000 and $1,500 in the disbursement pay. I joined her in her great effort for $2,000 and $500. We must continue that disbursement. We must codify unemployment. So it's not just that we do it by passing a bill when we have an emergency, but we must establish my legislation, HR 6271, the Unemployment Assistance for Individuals Act, that when there is an emergency, it goes into impact immediately, and you begin to have a source of income because you're responding to the emergency. Finally, let me say that this may need an expanded thought. As I listened to our professor dealing with the overall disparities, Dr. Ray, as many of you know, I've introduced HR 40, and that is a commission to study reparations. We must wonder why, when the tragedies of the nation are hitting everyone, how they are so devastating, in particular in the African-American community. Whether it deals with the impact of eviction or rent assistance, or again, income or lack of income, or lack of access to healthcare, or devastation as it relates to education, lack of access to technology, to laptops to be able to fulfill the responsibility to our children. We must look at the systemic impact that this has. And HR 40, the Commission to Study Reparation, is ready and able to carry this forward to deal with the systemic impact that happens, whether it is in normal times or whether it is in tragic epidemic and pandemic times, which are not going to end with this. They will be forthcoming. I look
Congressman Jackson,
with all of you.
Congressman Jackson, I appreciate. I do. You all forgive me. I do have to mention this. Someone posted on one of the feeds on social media that reparations are necessary to address the pre-existing illnesses and likelihood of illnesses, predeterminants of health, Dr. McDougall. Reparations are necessary to address those that put us in this place, in this position in the first place. So since you brought that up, I wanted to share that comment with the audience.
I just want to congratulate my mayor as I go out. Mayor Turner's done a stupendous job. Testing is what we've been working on in our city and in our community. Thank you so very much.
All right, thank you. Senior Vice President Todd Yeary. Do we have Todd? Okay, maybe we don't have Todd. All right, and there we go. Todd, are you there? But you wanted to say a word or two before we go to Reverend Jackson?
Can you hear me now?
Yes.
All right. Before we go to Reverend, first, thank you to all of those who have joined to be a part of this important conversation about the ongoing work to not only come through this pandemic, but also to rebuild afterwards. There are a couple of things that we have to make sure of as we continue to do this work. These conversations are really foundational. We are hopeful that we will continue to have a series of town halls with dates to be determined, because we've got more work to do and we need to come to some significant clarity about what those issues are. Number one, I think we ought to come away tonight recognizing that we have to protect public health and community wealth at the same time. It does not do us any good to save Black lives and then to watch Black businesses go under. And so we've got to make sure that we protect the anchors of our communities, to protect the economic viability of our communities, and to ensure that whether by legislation or litigation, we do all that is absolutely possible and necessary to protect the interest of the most vulnerable amongst us. And so we look forward to having these conversations with you, to our legislative and government partners. We appreciate your service and your sacrifice. We will stay in touch and we will be in tune to see what's next on the horizon. But we are grateful for Reverend Jackson's leadership in guiding us to this point. And we look forward to working with all of you as we go forward from tonight. Thank you, Mark Thompson, for your moderating. You're a good brother. Stay in the fight.
Thank you, Todd Years. And lastly, folks, I found the article. I want to give you direct reference. January 13, 2018, Huffington Post headline: Jesse Jackson is the most important figure in U.S. political history. And here he is with final thoughts and closing and benediction, the Reverend Jesse Jackson. Reverend, God bless you. Do we have Reverend? I'm looking myself. Saeed and Rose advised me his video's not moving, so I don't know whether the signal may have dropped. I'm not sure. Do we still have Reverend? It appears not, unfortunately. All right. That being the case, I've been asked to remind you to support legislation on voting by mail, bail reform, compassionate release, businesses, and the PPP. Remember to stay socially distant, stay safe. And that is what I have. Rainbowpush.org to find out. Yes, unfortunately, Reverend Jackson's connection went out. Do we want to take a minute, Shelley, to see if we can reconnect him for a moment? He's worth it. Let me know if we want to take just a second. All right, I don't know. I'm not getting a response from. Okay, we're gonna wait just a second and see if we can get Reverend Jackson back on for just a moment or two. Again, we want to thank all of the panelists who've been a part of this. Many of you have had questions. We're going to keep those questions and find another opportunity to answer them. We're going to have to do this again, obviously, and maybe one event. Todd and
Mark, can you hear me, Mark?
There we go. There's Reverend Jackson. Yes, sir. Go right ahead. If you could close us out, sir.
Well, I'm seeking to broaden the base of our leadership. We have a lot to say. Reverend Todd Yeary is a lawyer, a pastor, and a PhD. A lot to say and working like a short. Reverend Freddie Haynes, who chaired the commission on this criminal justice mission. Brother Rashawn Ray, Santita Jackson, who's a heck of a host of national radio show on. You, Mark. Part of my mission is this is a long struggle. It's today, it's the pandemic. It's also census. It's also protecting the right to vote. It's also a change in November. It's a long distance race. I want to thank Reverend Todd Yeary, Sister Jeanette Wilson, attorney, preacher, pastor, and all that. So Reverend Dr. Grant, who's a 1,000 Churches director. So I want to thank Jeanette Wilson and Bishop Grant and John Mitchell, Reverend Dr. Todd Yeary, who was a point person on this project between White House and the Congress, and the work of Sister Maxine Wallace. She works, and she's a rookie. She's in charge. We love you, Maxine. God bless you. Love you guys.
All right. All right, then, everyone. We again invite you to go to rainbowpush.org. And if there's nothing else, why don't we have a benediction, folks, if we could, please. And we say Ramadan Mubarak to all of our Muslim sisters and brothers who are recognizing the holiday. Let us pray. God, we ask you to receive in the cradle of your arms those who have already passed from this terrible corona. Please comfort and strengthen their loved ones with the assurance that the one you sent will bear their burdens and faithfully bring forth justice. Guide us to empty their tombs and resurrect those who have died by continuing ourselves to freedom fight to change the conditions which caused their deaths. And as we leave each other now to go about our respective responsibilities and families and homes, Lord, you are our refuge. Send our ancestors to linger to guard our doors and render impassable our thresholds to this evil plague and virus. We are more than corona, God. We are more than conquerors. Thank you for all who participated today. Thank you for the panelists, for the speakers, for the members of Congress, every single person who helped to organize and participate in this. Thank you to the National Medical Association, the physicians, the essential workers, Brother Chris, Brother Rashawn, everybody who has been a part of this. We are thankful to each and every one of you, even if I did not just mention your name. And now, to you who are able to keep us from falling at all times, but especially now in this pestilence, and who are able to make us stand healed from illness, grief, and fear in the presence of your glory with rejoicing. To you, our only God, our Savior, through Jesus Christ our Lord, be glory, majesty, power, and authority before all time, now, and forevermore. And the people of God said, amen. Thank you all. Have a wonderful evening.
Oh, man.
Long session. Maybe it's easier if I bring a TV camera.